Hi, welcome back. This is Gerald Major from #CArthritis from the 2019 Canadian Rheumatology Association Allied Health Professionals Annual Scientific Meeting. So it's a great pleasure to be sitting here with Amanda Steiman and to talk about some great work that you're doing, very patient-centric. So why don't you introduce yourself and talk a little bit about your project.
Sure. Thank you so much for having me. This is really exciting, and I'm glad to be here. I am Amanda Steiman. I'm a rheumatologist. I'm based out of Toronto, and I work at Mount Sinai Hospital there. And I see general rheumatology patients. I see all types of patients with rheumatic diseases. And the work that I do is called Project Echo Rheumatology. And Project Echo Rheumatology at its core is a weekly video conference session. And it involves primary care providers from across the province of Ontario in weekly didactic and case-based learning sessions with a rheumatology hub. And so through that interaction, we really hope to build capacity in the system, be able to have patients have care delivered or co-managed locally so that there's more rheumatologic acumen, so that primary care providers across the province have more familiarity, more knowledge, and more comfort with rheumatic diseases and how they're managed.
So I believe last night you were talking about not necessarily a lack of rheumatologists, but a lack of rheumatology acumen, was it?
Yes.
So explain that a little bit.
So it's a great question. I think it's not a trivial distinction. I think that rheumatologists are great. I have to think rheumatologists are great, and I do, because we need that skill level, we need that skill set, certainly. But there's also been lots and lots of research to suggest that a lot of the lag in diagnosis, a lot of the dysfunction comes very early, and we know that time is joint up front. So we know that if primary care providers are comfortable, have facility with knowing the early signs and symptoms of rheumatic diseases and are able to identify them, refer them when necessary, and or manage them, then I think we could be doing a lot better for our patients. And so while rheumatologists are very critical to rheumatologic care, I think that there's a really important collaboration that can and does happen in the context of Project Echo, and that we hope will expand further.
And make things a lot more efficient. I mean, we've heard recently, as last night with Andre Picard, talking about the waste that's in the system, and so I would imagine that this has a dramatic effect on rural populations.
Absolutely. So I think where the disparities are greatest is where we need this the most, because there is the opportunity for primary care providers locally to be well apprised of rheumatic conditions, to be able to co-manage. And with the Project Echo, we really build a really nice community of practice so that those people who are out in remote areas have a way to connect, to be able to bring cases forward and be able to discuss them with our group.
So not unlike what, I've been a patient since 14. I live with ankylosing spondylitis and psoriatic arthritis, and I spend a lot of time in Toronto. So I've also been very fortunate in life to have fantastic rheumatologists. So I know what to expect, and then it also allows me to advocate even more for the people that I feel don't get those things. So, I mean, early goings, what are you kind of seeing from like a knowledge share perspective?
So it's been really exciting, and we hope to start measuring this. We've been at this for 2 years now, so we're starting to collect some data so that we can really prove longer term outcomes. But we're seeing that the primary care providers who have been spending time at Project Echo, they've identified cases of ankylosing spondylitis, psoriatic arthritis, of rheumatoid arthritis, and so they've begun to deliver care locally. So patients with spondyloarthritis have started on NSAIDs, have tried them, have failed them, and have started to access biologic disease-modifying agents. We've had patients with rheumatoid arthritis started on methotrexate by their primary care providers. And so there's an increase in acumen there, as we've been discussing previously, and I think that's really exciting because the care can be delivered locally, or at least started while they wait for further rheumatologic care.
Yeah, I mean it's a great concept, and in business we've used it on knowledge transition. And I mean I moved jobs out of country before, and you have to then train a new culture on a new process, but eventually they pick it up. So I mean it feels like from a patient perspective, I know that within spondyloarthritis, I know what to expect from my AS and my PSA every day. It's the comorbidities that come as well that kind of complicate life for me. So I would imagine that, you know, over time, these family physicians that are learning these processes end up, like you say, identifying thing and then also being able to maintain.
Absolutely. Primary care providers are such important allies for us, and I think that we can really leverage what already exists in the system, and I hope that Echo is doing that. So comorbidity that you touch upon is so important, and we're learning that there's such a burden of morbidity, especially with these very chronic rheumatic diseases, both from an articular standpoint, a musculoskeletal standpoint, but also from a systemic standpoint. So with inflammation comes increased cardiovascular risk and so forth. And so we're learning this, and with our primary care providers as very important allies in management. And with increased awareness of these things, I think we're going to be able to help affect better care for our patients, and that's what it's all about.
Yeah, and I mean, even on the comorbidity thing, for myself personally, you know, a lot of the therapies that I use for, say, the arthritis are then also things that, so my psoriasis, I don't see a dermatologist on a regular basis. We're on the drugs that would help with that, so I don't need to be seeing that person, but there's other people, obviously, you know, for mental health and stuff that you continue to see. So there's certain things that you can kind of manage within the disease, not be a burden on the healthcare system. So I would imagine that you see a lot of those efficiencies starting to come in play.
Absolutely. There's more awareness, and I think with awareness, breeds facility and comfort. And you know, primary care providers are so capable and so able to deliver these things locally. And there's been good evidence that this provides greater patient satisfaction. Care is delivered locally. There aren't the long drives to and from major centers. And the satisfaction, and not only that, but the quality of care delivered has been proven to be on par.
So obviously, you know, awareness at the family physician level is something that patient advocates pay a lot of attention to, and quite frankly, haven't really been able to find a solution yet. So, what do the family physicians say about Echo? And are you having issues penetrating there?
So we're having a great time, and I think that the primary care providers are uniformly feeling very satisfied. So we really like to look at outcomes, and so the O in Echo stands for outcomes. So we know that their self-efficacy has increased significantly in all areas of rheumatic diseases. Their knowledge has improved. They're enjoying the process. They have real joy of work. And those are all things that are important to the sustainability of it. And so we don't want the penetration to be 100%. We don't need to have everybody with a passion for rheumatology and primary care. But if we do have local champions, if we have that one doctor in Massey, Ontario, or the one doctor in Powassan who is the rheumatologic primary care advocate, then they become local resources for their colleagues.
Yeah, this is beautiful. You must, how did this all come up? I mean, where was it born?
So it was born in New Mexico.
Okay.
It was born in New Mexico, and there was a hepatitis C epidemic there. And there were 2 hepatologists in the entire state. And there was no way that those 2 had the capacity to see and manage all of the patients who were suffering from this disease. And so that was when this idea was born. And of course it has utility in any common, complex, chronic diseases where that collaboration is so critical.
Wow, that's fantastic. So this year's theme in at the CRA is building bridges. So talk about a little bit about what building bridges means to you, and maybe then relate it into the patient experience.
Sure. So, I mean, I think this meeting has been, it's been poetry in motion, because we've seen so many ways that bridges can be built in rheumatology and otherwise. So we're seeing bridges in the presentations between basic science and bedside outcomes. We're seeing collaborations across the country. So there's a bridge there. We're seeing collaborations between disciplines. And I think for Project ECHO, I think at its core is really building bridges between rheumatology and primary care. And so there are so many bridges. And I think that is probably the future of medicine and rheumatology, is that we have this incredible ability to connect with people. And if we do, I think the whole is greater than the sum of its parts.
Yeah, and so I've been involved in advocacy now just over 3 years, I would say, and what I've been able to see in rheumatology specifically is that the change happened. There's been change happening in this last 3 years that is actually pretty fantastic. I believe that rheumatology is a little bit ahead of other groups as far as, like, as you mentioned, the collaboration that's there, the ability to go without or outside of your disease area. We're looking into cancer now and bringing things in here. I think the patient groups in arthritis have never been more collaborative than they are now. So are you seeing the same thing? Are you sensing this? You've been here a bit longer than I have, probably.
Absolutely. I think you're right. I think you're right on the pulse. I think that there's this excitement and fervor, because I think when we see the good that can come with these bridges, I think it's really quite inspirational. And so I do see that collaboration, that crosstalk within the specialty, between specialties, with patients. And so I think the sky's the limit.
Anything from online?
Yeah, it's about the Project ECHO. Are the people who give the video conferences, are they kind of teachers in Canada, healthcare providers in Canada, or are they national, like international?
So the hub of Project ECHO Project ECHO Rheumatology right now is in Ontario. Our hub is co-located in Toronto, and then we have remote hub members in Thunder Bay and Hamilton, actually. And so because this is video conferenced, it's a living room conversation that is held across the province. And our primary care providers are from across the province. And so we have penetration to all 14 of the local health integration networks. And so it's all very local, but it may as well be national or international, because technology makes it very easy.
Yeah, that would be really neat if it becomes national across Canada.
Yeah.
Okay, that's it for the questions.
Well, thank you, everyone. This has been Dr. Amanda Steiman. I can't think of a better person to be in charge of, what's happening going forward in rheumatology. So I thank you so much for what you do.
Thanks so much for the opportunity. Thanks for what you do.